The healthcare system nationwide continues to face a series of challenges, including right here in Wisconsin. Our Kyle Pozorski sat down with the man who knows perhaps the most about those issues that the Badger State is facing to get a pulse on Wisconsin's hospitals.
I think all of healthcare is under stress these days.
That's Eric Borgerding, President and CEO of the Wisconsin Hospital Association, an organization of the state's hospitals and health systems. Our nearly hour-long conversation focused on the state of healthcare with several key challenges he sees facing the industry, which he's called home for 2 decades.
I've been at WHA since 2002.
We began by talking about the COVID-19 pandemic and the effect it had on the healthcare industry struggles, saying it
and exacerbated them kind of all at one time. What at least my members all realize is things are not going back to the way they were in 20. And by the way, 2019 wasn't some nirvana, right? But they're not going back to the way they were in 2019.
Borgerding suggests in the years since, inflation in the U.S. economy has
exacerbated
the financial side of healthcare. From January of 2020 to January of this year, inflation has rose 19.3%.
That has a massive impact on the cost to provide the care.
Things like supplies, drugs, and the workforce, which according to the WHA takes up anywhere between 50 to 60% of a hospital's operating budget. And it was only last October when WHA's findings showed 53 of Wisconsin's hospitals operated in the red in 2022. Despite this, Borgerding remains optimistic for Wisconsin's hospitals, citing outside data which suggests Wisconsinites are not receiving worse care than in the past. It was back in August of last year when the Centers for Medicare and Medicaid Services ranked Wisconsin as the 4th highest percentage of 5-star rated hospitals out of any state.
It's getting harder and harder to sustain that excellence, number one, and also to sustain access.
Borgerding's biggest concern, though, continues to be that of lower reimbursements to hospitals, concerned that as the amount Medicaid, Medicare, and other insurance routes provide dwindle, so too will access to top-quality care as programs and services are cut.
We've got to improve that.
He says any solution to this comes down to what WHA can continue doing to advocate and lobby to create legislation providing for a stable future of Wisconsin's hospitals. I'm Kyle Pozorski, News 3 Now.
And to view in-depth details discussed in Kyle's interview with the WHA President CEO, just look for this story at channel3000.com.